The faculty and staff at Texas State Technical College want to thank you for taking your time and energy in helping us in training our EMT and paramedic students. It's critical the role that you play in helping us to educate and train and prepare these students for field work. The time that they're going to spend with you is crucial, and you play a vital role in their growth and development. So we want to thank you for that time and that energy that's spent in training our students. This is a very rewarding role. You'll be able to observe and see the transformation of these students as they come in at an introductory level, as an observer level, and they begin to learn what EMS is all about. They're going to come in early with some minimal skills that are going to need development. And as they grow and transform in front of your eyes, you're going to see them move towards a role more of being a team member. They should begin to develop skills and abilities that you've helped to guide those students with, as well as other theories and ideas about EMS and how EMS works. Serving as a preceptor is a critical role for the development of our students, and we want to thank you again for taking that time to do that. There are some specific expectations that we would like to see from our preceptors to help optimize this learning opportunity for our students and the development of these future EMS professionals. As a preceptor, we do ask that you be present during all skills that the student may be performing. And this may be oxygen administration, placing the patient on a non-rebreather mask, or starting an IV. Those are important skills that be observed by you as the preceptor to ensure that the student is performing these skills correctly, and to hopefully receive some feedback and some direction as they're performing these skills. Also, the opportunity to identify learning experiences for the student is another thing that we do ask for you as a preceptor. You're going to understand the things that are specifically going on the student may miss unless you kind of guide them towards these learning experiences. Also, we want you to take the opportunity to explain clinical techniques as these opportunities arise. So as you're looking at specific situations and you see something coming up related to patient care, take the opportunity when it presents itself to explain something to the student. Also, hold the student accountable for their actions and judgments. We want you to be observing and watching how they're responding, how they're acting, what's their behavior. I think it's for all new EMS professionals, it's kind of a challenge stepping off into this world, and the behaviors that we had as a non-EMS person have to change when we get into this profession. And you know those things, and take the opportunity to help look at the students' actions and how they're thinking and judging situations is a critical opportunity. Also, actively stimulate critical thinking by the use of questions and answers. We want you to ask questions of the students. We spend a lot of time in the classroom teaching theory, and in the field they're out there to learn application. By asking questions and challenging them, it helps to bring home this gap between application and theories. Also, we want you to guide the student to assess the whole patient. It's very important that the student learn patient assessment and learn the whole assessment. So taking that opportunity to allow the student from beginning to end to be directed in patient assessment. Also, to provide pertinent feedback after each contact. When they're finished with the call, they need that feedback. They need that opportunity to be critiqued and be directed in things that they could have done better, or maybe something that was going on with the call that was not within their control, but you can teach them from. Maybe something that happened that you've already critiqued, and it's something that's obvious to you, but may not be obvious to the student. Also, to discuss the relationships of EMS professionals with individuals like medical direction, other staff like nurses, and other health caregivers that you may come in contact with. But that role of the medical director is a critical role that the student really has very little concept of prior to coming into EMS. Also, we want you to use effective counseling techniques and coach the student from observer to team leader in the field. In other words, they're going to be developing over these semesters from being a brand new student walking out the door who's just observing and just seeing how things work, eventually moving more towards a team member role. They're going to be actively participating with you in patient care, up to the point in their final semester where our objective is that they're a team leader in patient care. Now that's a very specific area, and we'll talk about that in another video, but we want you to help progress these students and counsel these students along that journey. Also, to maintain an environment that's free of harassment and discrimination. In other words, we want a safe environment for the student. We know that you work very hard to ensure safety at all times for yourself and your partner and your patients and your students, and we don't doubt that at all, but we want to encourage you to think about the student, and they're so brand new to this EMS world, they don't understand how everything works. So sometimes it becomes a little hard for them to understand how EMS works and how the relationships work and how people communicate in EMS. So just keeping that in mind and ensuring that the student always feels safe and always feels comfortable in that environment. And sometimes that puts us as EMS professionals in a challenging place. Also, we want you to help establish that standard of care. We know that you work under these guidelines of a standard of care, but this is something sometimes new for the student, understanding and experiencing this idea of a standard of care, why we do the things we do and why they're important that we do them. And having this standard of care obvious and evident and establishing it with the student is a critical learning experience for the student. We also encourage you to promote this idea of teamwork. It's a little challenging at times when you have a new student out there and they're not really sure what to do or what's allowed, but encouraging and pulling this individual in to be a part of the team is important, and we encourage you to do that and to take the time and the energy to promote teamwork with the student. And sometimes it may require some direction and guidance, because a student may want to stand back and not participate. And that's really not acceptable. And we encourage a student to step up, but it's that comfort zone and that feeling like they can. Obviously, we don't want them stepping in and making critical errors or mistakes, but we definitely encourage you to involve them as part of the team. We want you to orient them to site and to the crew and to the equipment that is specific to your facility, to your unit. The students may not be familiar with all of the different aspects of the unit or the service that you're working for. And so an orientation to that is important, and taking the time to direct them on how things work within your service. Also, to deal with issues as they arise, and to do that in a professional way. If you see issues, you have issues, we want you to take the responsibility for addressing those issues. We want it done professionally, because these individuals are out there learning about our profession, and sometimes for the first time. But take the opportunity to guide them and to address the issues. If there's issues that you need to address with me about a student, please feel free to contact me at any point in time. Also, we want you to take the opportunity to help to develop the student's confidence. We want you to promote confidence in the student. There's really no successful EMS personnel who has a lack of confidence, and we all know that. So promoting that and developing that in the student is really another crucial aspect of their learning. And then we want you to empower the student. In other words, we've done all these things to get to the point to where we start to empower the student to stand up and step up and to perform skills and to be confident to do the things that they're learning and that you're helping to teach them. So please take that opportunity. And last but not least, we want to always ask you to ensure that you represent the profession and your service in an optimum view. These individuals are coming out, some of them brand new, right out of the general public into EMS, and they have a perception, and they will be part of, continue to be part of the community that you work in, and they're going to develop this feeling and this this view of your service and you as a professional and EMS as a profession. And we want to encourage you to always keep that in mind as an EMS professional when you have students in the field with you, because it does reflect in the long term on your service and on the quality of care that we as EMS professionals provide. The purpose of clinical internship is to provide our students with an opportunity to experience various types of patients. We want these students to be out there with you, experiencing patients, also taking the opportunity to observe and participate in different management techniques of patients, to also hit their hands-on with patient assessment. These items are critical in the students learning how to function as a paramedic. In the classroom, we're teaching theory, and we're teaching processes, and we're teaching skills. But in application, they learn that in the field, and they learn how all these pieces come together. Some simple things and some points to describe this is we want to translate theory into practice through a collaborative relationship with EMS professionals. And so having this relationship with you is necessary in the development of our students. We also want to develop effective clinical judgments based on interactions with professionals who demonstrate success in the EMS practice. We want them working with you, successful paramedics and EMTs, to develop this judgment on the behalf of the student. We also want this to increase competence and confidence under your guidance. We can teach them in the classroom all day long, but until they are out there with you and they experience it and they see you perform as a professional, it doesn't make complete sense. We also want them to benefit in this relationship between EMS education and EMS practice. And so I've kind of said the same thing over and over, but this is a critical aspect of this. And we also want them to develop competent, safe, and ethical behaviors as an EMT. And seeing that, observing that, and living that is how that's going to happen with the students. Student responsibilities. The student is responsible on a daily basis at the clinical site for tracking their daily skills. They are accountable to track everything that they're engaged with, be it an IV, airway management, a patient assessment, listening to lung sounds, checking vital signs. So the student is accountable for documenting and tracking all of those experiences. They're also responsible for being on time to the clinical site. And I can't stress that enough. We want them on time to the clinical sites. And I know many of you help support us in this, and we have no problem with you sending the students home if they're late to clinical. They should also be dressed as professionals at all times. And that goes along with being on time. So when they show up, we want them dressed appropriately. If you see something inappropriate about their dress, if they're not looking professional, that's a critical aspect in the learning that they need to develop. And we also encourage you to send them home for not being dressed appropriately. They're responsible for completing all clinical documentation. So the student has to document and track all of the time that they spend there. They have an hour form, tracking form that they have to complete. They also have to complete an evaluation, self-evaluation, and an evaluation that you're going to complete on them. And they also have to write a PCR for their patient contacts, a patient care report. And they have to track their skills. And this is a part of the student's responsibility. They have to remain present and actively engaged during the entire rotation. It's not acceptable that the student be sleeping at a clinical site unless it's a 24-hour site and that has been pre-approved that they can go to sleep at nighttime. When they're at the clinical site for a 12-hour clinical, they should not be sleeping. In downtime, when you are resting and you're sleeping, that student should be studying, completing documentation, checking out the unit, checking out the equipment, but actively engaged during the entire rotation. The student should abide by facility and program clinical rules and policies. They should be, just like the employee will have to do, they should have to follow the same policies. So ensure that these students are following any kind of policies and site responsibilities. The student must perform to appropriate skill, knowledge, and level. They cannot perform above their skill level. I know a lot of times students, EMT basic students, may come back and tell me that someone asked if they wanted to start an IV. And to me, the student probably did not communicate clearly when they first got there what it was that they were eligible and able to do. So the student should not perform above any skill level. And we want them to communicate clearly when they get there what their skill level is. The student should be prepared for the clinical day and demonstrate professionalism throughout the entire experience. If you have a student who is not demonstrating professionalism, this is not an acceptable behavior, and we definitely want you to address that behavior in a professional way and manage that as necessary. And please contact us with those situations. We want the student to be responsive and respectful at all times to the preceptor and service representatives. They should represent themselves appropriately and professionally, represent the school professionally, and they absolutely should be respectful to you at all times. And that's not an optional behavior. The student must assume responsibility for understanding the requirements of this practical experience. And they must fulfill those clinical objectives while they're at the clinical site. And a lot of times students are challenged with this aspect of understanding what's expected of them. Even though it's clearly described to them before they go to clinicals and there's plenty of resources for them to understand this, sometimes they just lose track of what their responsibility is. Maybe they've gone to a lot of clinicals and they're starting to get tired and it's getting near the end, and so they start to slack off. We want you to help us to ensure that these students are fulfilling this responsibility. The student is also responsible for maintaining open communication with the preceptor to promote achievement of the clinical objectives. We want to make sure that our students are communicating with you, that they're letting you know what it is that they need to do and what they need to accomplish. And they should be aware of that. Sometimes a student may need some guidance from you as a preceptor to help guide them in the right way. That's why we're providing you with some resources that can help you understand what their objectives are. But please help to ensure that, and they should ensure that themselves. The student is also responsible for recognizing their limitations and for seeking assistance when it's appropriate. We don't want our students performing inappropriately in the field. And if there is a limitation, they should be able to recognize that immediately. Maybe it's understanding an assessment process. Maybe it's understanding a simple skill like vital signs as a new EMT basic. How do you assess that blood pressure driving down the road? What things should they do to improve that skill? That might be an example of their limitation. And they should ask you. They shouldn't spend a long time not being able to assess the blood pressure and not communicating that to you, that they're struggling with that. They should also seek and participate in opportunities to acquire certain skills, those psychomotor skills, appropriate for their level. So if their skill level allows them to ventilate a patient with the bag valve mask, then we would want that student to seek out that opportunity. Not to stand there and just watch someone else do it. They should seek out that opportunity. Or if it's to do compressions on a patient in cardiac arrest, we would want that student to seek out that opportunity. Sometimes they may need a little nudging in that direction, but they should be seeking out those opportunities. The student should be professional, responsible, and respectful. And I've already touched on this before, but it's important enough to say again. They should be professional, responsible, and respectful at all times. They must also be accountable for their own actions and their decisions. In other words, when they make a decision or they take an action, they own it, just like EMS professionals do when they're caring for patients. So any decision or action that a student may take, they will own that decision and are accountable for that decision and should be held accountable for those decisions and questioned on the decisions that they're making. and they must also actively participate in the evaluation process. Evaluation is critical, and I can't express that enough. Evaluation from the preceptor to the student, and the student's self-evaluation of themselves, looking at their performance and evaluating the quality of their performance. What to look for as a preceptor. When students come to the clinical site in the field and on the ambulance, they're going to be performing skills sometimes for the first time. Sometimes they've been there for a while and they've begun to develop themselves. As a preceptor, we want you to look for certain things and to develop some certain things in each student that's coming through. Ability to communicate clearly with patients. Students must have the ability to communicate. This is a critical aspect, as you know, as an EMS professional in the management of patients. We are not successful without clear communication, the ability to talk to patients at any time, in any situation. Students must be developing this, and this is what we're seeking for the student to grow in. Also, the ability to manage the scene and environment efficiently. Management of the scene is a tool that is learned and does take time to develop. It takes confidence to develop and understanding of how things should work. And so the student should begin developing the skill early on and progressing as they move through the process of becoming an EMS professional. The ability to complete a thorough patient assessment. Each student learns patient assessment from EMT Basic on, and we want them to develop this skill in the field and be performing this skill on patients. We realize that a lot of times as a new student, this skill is kind of limited. They may be allowed to do certain aspects of the skill, but maybe not the complete skill. As they develop and as they grow, we encourage you to give the opportunity and to look for this growth in the student and their ability to assess the patient. The ability to identify a patient's chief complaint. This is the core to patient assessment, is identifying what is the patient's complaint and why are they what are they complaining of. So the student sometimes is really challenged, and I know it seems simple, but they're really challenged with understanding the patient's chief complaint. The ability to formulate and provide appropriate treatment strategies at the student's level of training. So if it's an EMT Basic, an advanced student, or a paramedic student, we want the student to be able to develop these appropriate treatment strategies. The ability to follow direction and show development towards clear communication and leadership for other caregivers, the patients, and other individuals that are on the scene. Evaluating the EMT or paramedic student. Evaluation of each student is a critical tool. It's a critical aspect for the student and for the program. We need to know how the student is performing. And so I know a lot of times this is a challenge for preceptors. They don't want to hurt somebody's feelings. Maybe the investment and time and energy in the individual is not there. They've maybe struggled a little bit, and maybe in your mind you're just kind of ready for the student to move on. But evaluation is a critical step in the process of learning to become an EMT, or realizing maybe a student doesn't have the skill to be an EMT. And we need to recognize where the student is at in this journey. And the only way that we can do that effectively, outside of what we're doing in the classroom and what we're training in the classroom, is by having you help and participate in that process of evaluation. Every aspect that we've already talked about of the student has to be evaluated, and we want your feedback on those areas with the student. The student will provide you with the evaluation forms and tools to give feedback. We want you to take the time to be honest with the student. The student's been advised that sometimes they may be told some things that they don't want to hear. That's going to happen. We do encourage you to do it in a professional, mentoring way, but we still want it to be 100% honest. And so take the time to fill out that form. At the top of the evaluation form, there's a numerical evaluation, numbering them from 5 being excellent all the way down to 1, which needs improvement or poor performance. They're going to be evaluated on their skills. They're going to be evaluated on their work ethic. They're going to be evaluated on their leadership, on their communication. There's multiple areas that you will evaluate them. We want you to take the time in the areas that apply to give them a numerical score. If you score them anything less than a 3 or a 3 or less, we want you to take the time in a little box provided below that to give us some feedback why they received a 3 or a less. That's important. It's important to the program, it's important to the student to understand what it was that was their weakness or where they need to develop. Also, there's an area at the bottom for you to document what were some of the student's strengths. We want you to take the time to look at that student individually and really think about what you see in that individual that you would identify as a strength as an EMT or strength as a paramedic. And give that feedback. More importantly, on the areas that need improvement, we want you to also give that feedback. It's important. And yes, sometimes it might hurt the student's feeling. Maybe they didn't show up and look professional. Maybe they didn't look like they were engaged. Maybe they were too quiet. There's all kinds of lists of things that may present as a challenge that you can see would possibly make them not as successful as an EMT or a paramedic. Many times the students come through and they are very strong, and there's not a lot of things that they need improvement on. But we want you to look at that student critically to help them be better, because they're going to leave this clinical experience and they're going to grow and develop based upon the critique that you give them and that we give them in the classroom. And if there's no critique, there's no growth. It doesn't happen by accident. Yes, they may observe you and watch other individuals, but getting that specific feedback on areas that may be challenging for them is necessary. I find often one of the big areas is confidence, communication, and skill performance. But sometimes individuals have other challenges that may even block their true ability to be very successful. And sometimes those things can change and they can develop and improve on, but they won't improve if we don't give them the feedback. So evaluation is a critical aspect. The purpose of the evaluations are to track the student's skills. We have to track their performance of the skills. So if they're performing a skill, we need to know, was it performed correctly? That's a purpose of the evaluation. We also need this evaluation tool to be able to provide a monitoring of the student and their progress and behavior. We need to know how they're growing and developing. We want the student moving in the right direction, but without feedback, without guidance, we won't know. And we want this evaluation to be able to provide feedback for review by the student. The student needs to be able to go back and say, you know what, early on, this was an area that I was struggling in. I didn't have any confidence. But I can see through my evaluations that now that's listed as one of my strengths. I'm confident. And we can see this progression and this growth. This is also necessary for the program. It is necessary that we evaluate each and every student's performance and development. And that is our end goal, that our students come through our program, get the tools necessary to go out into the field, and they go out into the field with you, and they start to use and develop and apply these tools appropriately. But defining appropriate is through evaluation, and we need you to be an active participant in the evaluation of the student. Sometimes you may reach a point where evaluation is something you can't put on the piece of paper because you just don't feel comfortable doing that. I understand that. Simple way to fix that is to call me. I'll probably ask you to write me an email defining it so that I can have that as a document. I may ask you to fill out the evaluation form and just fax it over to me. If you're not comfortable telling the student face-to-face, I will communicate your concerns or challenges that you see in the student with the student, and I will do it appropriately. But I need that information, so please don't be hesitant to give the feedback that's necessary to identify the student's growth and performance. Thank you again.